Next in our AM 560 Weather Center. Chilly day ahead. We'll have increasing amounts of sunshine throughout the day. High 44, cloudy, chilly again overnight, low near 30. It's 34 right now. Next news at 8. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, and your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. Let freedom ring this afternoon at 2 with Sean Hannity on AM 560, The Answer.
Good morning, Dan and Amy. Dr. Scott Gottlieb, former Trump FDA director, now at the American Enterprise Institute. He writes in the Wall Street Journal, winter is coming, time for a mask mandate. Masks will help as a practical matter. It's easier to wear a mask in the winter than in the summer.
Oh, I'll just put a scarf on, thanks.
A mandate can be expressly limited to the next 2 months. It's long been known that masks can reduce the spread of flu, and the same logic applies to coronavirus. I'm not a medical doctor. Dr. Scott Gottlieb is.
Where's
but
the science and data behind that?
It's long been known that masks can reduce the spread of flu. Well, we've looked at a lot of studies, including from the WHO, World Health Organization, that suggest that statement is incorrect. So as we continue to throw this hot potato around, I know it's an somewhat ancillary issue, at least it is for many of the scientists and medical professionals, but it's become the issue, even more so than a vaccine, because COVID-19 has become so politicized. So I guess we need to start there with Dr. Roger Klein. He is a doctor as well as a lawyer. Boy, talk about right brain, left brain. He's also an expert with the Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, former advisor to the FDA, CDC, CMS, and HHS. Dr. Roger Klein, thanks for joining us again. Appreciate it.
Yeah, hi, Dan. Hi, Amy.
Hello. So Dr. Gottlieb says that these Danish scientists who've actually done a study on mask wearing can't get their study published for some reason, and the previous research on mask wearing as it pertained to the prevention of influenza spread is mixed at best, and so I'm left baffled.
Well, yeah, right, Dan. I don't know where Scott is getting his information, but there are multiple meta-analyses on influenza for sure, and it's never been shown. That's why it had mask wearing by the public. And again, these aren't even masks. They're scarves, as Amy said, has not been recommended in the past. And in fact, CDC overtly and expressly, and WHO recommended against this practice. So I think it's a sideshow, quite frankly. It's really a political discussion. It's not a medical or scientific one.
Mm-hmm. And what about the numbers? I know the CDC kind of moved the goalpost last Thursday, and now besides the PCR test, we're also counting antigen tests. And can you just explain what those are and why that's a part of the conversation now?
Well, the PCR tests are really more the gold standard. They're amplification-based tests. They look at the actual genetic material of the virus, so how much of the viral genome is present, and quantify the numbers of it, and then determine whether it's positive or negative based on the amplification rates, because you can have sort of background noise. But that's a gold standard test, and it's highly sensitive, extremely sensitive. Doesn't even mean you're sick. You could have gotten over the infection, and it could still linger around. And they're very highly specific. And then you have these antigen tests, which look more at the proteins that the virus sheds, and those tend to be these rapid tests that you can get back in 15 minutes, and those are accurate, but they tend to think sensitivity in many instances. So you can miss infections more easily than you would with one of the PCR tests. And I think it's fair to to discuss to include the antigen test and the PCR test together, but it's helpful or more useful to break them out because in a sense, a PCR test, which is done in a central laboratory most of the time, is would be more considered the gold standard versus a test which is highly useful, the rapid test, but sometimes would be more inclined to be, would be more likely done in an office setting.
Right, but is that the correlation between now all of a sudden every state in this country has, cases are rising?
It's related. I mean, it's the infection spreading too. I mean, I say, look, the president mentioned cases and testing, and he's completely right. It's not the whole explanation. It's part of the explanation.
Right. I mean, it's a contagious virus as well, which we've always acknowledged. Something else that hasn't been acknowledged is the ever subtle change in language over the last 6 months with respect to the virus. It has gone from flatten to slow to stop. Flatten and slow, I understand. Stop seems to be a position that Joe Biden took at the debate on Thursday night, that the media seems to be taking by just focusing on cases, regardless of the nature of those cases. Is stop something that's possible?
No. So these discussions are political, and this is really all a lot of unfortunately, it's not despite people wanting to claim they're using science, none of this is scientifically based in my view, because we don't really have a lot of answers. The reason that it's called a pandemic is because the virus is spreads and we can't really do anything about it, or we can do little about it other than staying away from other people. If you look at Europe right now, it's tearing through Europe. We have different performances in different countries and different states of the United States. They don't seem to have a strong relationship to the practices that are held there. That's why if masks help somewhat or coverings help somewhat, and we don't know that for sure. Whether they would affect the ultimate outcome, it seems unlikely, and we don't see associations that are strong, so their effects are mostly minimal. We have a contagious virus. It's more contagious probably than influenza, and it's really, really hard to stop this from spreading. And that's what we need to do, and I think we've said this all along, is to focus on protecting vulnerable people to minimize the numbers of deaths and trying not to overrun the hospital system. And we've been very successful, certainly, I think actually in both, after the initial period. And deaths are way down, but we've also not experienced an overrunning of the healthcare system. And that's really what we can hope for as this virus runs its course.
Yeah, just to take a step back about your profession, does it rankle you at all? I mean, I read your sort of top line bio at the outset, and I mean, you're as credentialed and as experienced as just about anybody else discussing these topics or working on these topics around the country, in combination with infectious disease experts like Kuldorf at Harvard and Gupta at Oxford and Bhattacharya at Stanford and Henry Miller at Pacific Research Institute, who is the founding director of the Office of Biotech within the FDA. And all of you folks are not part of the legitimate scientific community anymore, as I understand it, from the way this is reported by the press and talked about by certain politicians. The sort of cognitive dissonance, the sort of textured explanations you're providing, we don't have any time for that, Dr. Klein, and so you're part of the problem. Does that bother you and your colleagues at all?
Yeah, I can't speak for others. I don't really feel that, and I recognize it's hard to get on media and have a contrary point of view to what the media is representing, but they don't represent the mass of people who look at the issues. They represent some people. They're usually cherry picked. It really, the whole thing hurts me because I don't feel that this is not how you handle science and medicine. You need to have robust debates, especially about in areas in which we don't really have answers. And those people who would try to control the behavior, for example, of others who have a political agenda are really the ones who are harming harming the situation, because we really need to have robust and vibrant discussions about how to handle a complex problem that we haven't faced before and about which we have limited knowledge.
You mentioned in your piece, confronting COVID over at the City Journal, this phrase that will generate much opprobrium. And look, I just had a video call with a friend of mine's father who is on a ventilator, who is in dire straits because of COVID. So there's a complete recognition of how serious this is for some on this show, and there always has been, as I know there is with you. But if you say what you said in this piece, which is, let me quote you, "It's widely understood that the epidemic will not end unless and until we achieved an undetermined threshold of population immunity, sometimes referred to as herd immunity, wherein the virus runs out of people to infect." You invoke the prospect of herd immunity, even combined with a vaccine, and you're somebody who is indifferent to human suffering.
Yeah, so that this is just a biological fact. I mean, I think so. Again, this is what Scott Atlas was criticized for, a statement, saying it's a strategy. It's not a strategy. It's a fact. It's something that has to happen, that most people believe has to happen in order for the epidemic to go away. If you look at the letter that 100 Stanford faculty members wrote criticizing Scott Atlas, they make this identical point. And what they say is, we believe the best way to achieve this is through a safe and effective vaccine that's gone through the regulatory process. And I think so. The vaccines can create this level of population immunity, as can infections. My concern all along has been that we've been in a race really between infections and vaccines, and I think you can't just shut your entire country down and try to lock people up to slow the spread until a vaccine may or may not appear. The administration has done a terrific job in every possible way with respect to vaccine development, and I'm very optimistic that we're going to have something. We don't know how well it will work. Look at the flu. I mean, the influenza vaccine is, sometimes it works, sometimes it doesn't. I think we need to live with this thing and really do everything we can, and we can do this, to protect elderly people and vulnerable people, particularly those in nursing homes, where 40 to 50% of the deaths have been traced to, because these are institutionalized settings, and so you have much greater control over the environment. And I think that those resources are extremely well spent. They're not well spent trying to protect young people for whom this virus poses very little risk.
He is Dr. Roger Klein. He is an expert with the Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, former advisor to the FDA, CDC, CMS, and HHS. Dr. Klein, thank you for your insights as always. Appreciate it.
Thank you.
Thank you. And he joined us on our turnkey.pro answer line.
If you're talking about it, Dan and Amy are talking about it. It's Chicago's Morning Answer on AM 560.